Welcome to the local San Diego leadership on responding to co-occurring pandemics, COVID-19, and anti-Black racism within their organization's video. This video includes 2 interviews with local San Diego leaders. The goal of these interviews is to discuss the co-occurring pandemics of COVID-19 and anti-Black racism by inquiring with local organizations about how they are responding to and supporting their workforce and the participants from the community they work with.
My name is Brian Bauers. I am the Director of Operations with the Wayback Residential Treatment Facility in Golden Hills, San Diego. I am one of the directors here at the facility on the executive team and part of the leadership team in charge of making operational decisions and choices and changes. So that's a little bit about me. Our facility, we've been around since the 70s. We treat men with substance use disorders. And we have always tried our best to be all inclusive, to be non-discriminatory, to reach out to not only the African American community, but the other marginalized populations in the San Diego area as well. We don't really do much outreach here. We stay pretty full consistently throughout the year. And we are constantly trying to learn and grow and be more inclusive. And we put a lot of effort into that as a leadership team and try to pass that stuff down to our staff. So as to the first pandemic, the COVID-19 pandemic, we've done a lot of things to try and put mitigation efforts into place and updated our operations on numerous occasions to try and address this. We are constantly looking to the CDC for guidance. We are looking to the county for guidance. And we stay fluid. What we've done up till this point is we actually haven't lowered our census. However, we have made adjustments to our bed situation and where they're located to allow social distancing. So we've stayed pretty full through this whole thing, with allowing for mitigation efforts to take place in our facility as well. We've instituted a mask mandate facility-wide. For participants and for our staff. And we have continued to battle this pandemic as best we can. I think Chris, who is the executive director, and myself, we have a philosophy back here that we talk about in the office, best practices to the best of our ability. And some people may not like those, participants may not like those. But I talk about this often as well, is, in 2 years from now, we may all look back on this and say to ourselves, wow, we really went a little bit overboard with that. But I don't know that right now. Chris doesn't know that right now. And the best that we can do right now is everything that we can possibly do to make sure that we protect the safety and security of our participants and our staff. So that's kind of what we're doing to address the COVID-19 pandemic. The COVID-19 has taken a little bit more precedent. However, that doesn't mean that we back here as a leadership team haven't started to address that as well. Chris and I are both involved in numerous trainings, numerous work groups, and we participate in these things actively and often. And we try to inform our staff as much as possible about what we're learning. We don't really do outreach out in the community to reach out to the African American population. However, we have really tried to do that with the participants that we serve here that are currently participants, by meeting with them individually and just letting them know that, we have empathy, but we may not understand exactly what you're going through, but know that we care, know that we want to understand, know that we support you. And we really send that message to our staff, and which trickles down into their counseling techniques, their interventions, their treatment planning. I am a part of the CCRT, which is the representative from ADSPA that participates with the county in how to address inclusivity. And so I'm happy to be a part of that team and bringing that information back to ADSPA, which is the group of providers in San Diego that all get together and we talk about challenges, barriers, solutions to problems, that sort of thing. So I get to bring that message back to the providers and come up with solutions to some of the stuff that we face here as a network, not just as an individual facility. And I think one of the pandemics that's not being addressed right now is the misinformation and disinformation that is coming to us at extremely high speeds through social media, through news outlets and agencies and things like that. So one of the things that I have taken on here is to present accurate facts, science-based information, history, and really try to give that information to our staff during multiple staff meetings. We hold an all staff meeting once a week with the entire staff of our organization, and we talk about that sort of thing. And we talk about what is happening in the community, what's happening in the news, what's real and what's fake. And we've really instituted part of our contract is the Hatch Act, and I say this because we tend to we try to have everyone leave their views and political views at the door, and we've really instituted the Hatch Act to make that happen. Everyone is entitled to their own beliefs and opinions, but when you come here, you're a professional. Right? It doesn't matter what you believe politically or otherwise. We ask that you be professional here at the facility. And we're really strict on that message, and we really institute that message here. And with that, we've seen that even though some of the staff members may not agree with some of the stuff that we're trying to implement here, they are able to do that and leave those opinions at the door. So it's a little difficult with some of the staff right now. We have a lot of staff with lived experience, and lived experience for us means that a lot of our staff have gone through the prison system, have been a part of the criminal justice system. And what that system teaches you is segregation, right? And some of that is hard to let go of. So we do a lot of stuff on bias and identifying a lot of those bias that you have and that need to be addressed. Some of those implicit, those unconscious biases that they possess. We do a lot of transference and counter-transference trainings to identify some of that stuff and to keep that from being implemented in some of the interventions that they're doing with the participants. So we really try to get down to where we're just presenting facts. So I think we're doing really well with that. It is being shown in our success rates here at the facility. We do really well. We are inclusive. We have probably a 25% non-white population here at any given time throughout the fiscal year, and we really reach those individuals. We have those every week in staff meeting. We will talk about any updates that we have for them, anything that we took trainings on here in the back. We actually ask the staff to participate in more hours than are necessary than the county is asking them to have, just so they can kind of, they're getting that, every month or every quarter, they're getting an update on culture diversity, and they're really challenging those biases and talking about them in staff meetings. So slowly but surely, we're coming a long way. It's a slow process, but we are constantly addressing this every week. All-inclusive services to a multiple array of individuals throughout the community of San Diego, and treating and having those individuals that we are treating, those participants, bringing that message out into the community that the way back is all-inclusive and treats each other with respect, no matter where you come from or who you are. We have an executive director that is gay, and he brings a lot of compassion and acceptance to the team, and he teaches that acceptance and those experiences that he went through when he was growing up, the stuff that he still experiences to this day. He's very open about that discrimination that he's faced throughout his life as well. So again, we totally try to implement that on a daily basis here. And I guess our end goal is just to have these participants leave feeling more accepted, feeling more valued, feeling more equal to than when they got here. So I would love to hope that they're going to be better. I think it may be too early to tell since we just really started to try and address some of this systemic racism, some of this discrimination and things like that. However, I can only hope that the effort that we are putting in here as an executive team in the back office that is trickling down to our direct service staff is going to have benefit to the participants that we're serving. I would hope that. I see that in the future. We often talk to our intake coordinator about her approach to bringing in intakes and bringing in everybody that is qualified or meets our level of care without having any type of other opinions or anything like that into that. So I think from the intake perspective, we are bringing a lot more of the marginalized population in from San Diego than we have historically. And I don't know what that can be attributed to. We haven't really tracked that, but I do see a more diverse population coming in over this fiscal year, and hopefully that's correlating into better outcomes for that population as well.
LaChapelle. I currently serve as the Chief Executive Officer for the San Diego American Indian Health Center. Very privileged and honored to be in this role. My background, some law enforcement background, as well as a professor at a couple of universities. And also I do a lot of service with refugee populations. And I obviously have been through the COVID situation that we've been navigating through, COVID as well as the testing and even vaccinations and operationally. So thank you for this opportunity. You know, some of the changes that have happened, I would say, have been fairly drastic. And things kind of they happened at different levels, and a lot of it was dynamically changing as situations basically presented themselves. So it was a lot of using situational awareness. So March 16th was when we first were alerted that we would be really changing things very significantly, and that we would be using telehealth and things like that. So a couple of things we initially did was determine who are essential employees here and who can work from home to right away try to help keep people protected by not having to leave their homes. Also, we had to start looking at our patient mix. We had some dynamics happening. So behavioral health had right away very immediate needs because the number of people seeking behavioral health jumped significantly. And so we had to look at doing the teletherapy, which has actually worked well. In fact, we've used COVID really to our advantage because there's nothing we can do about it. It's here. But what I mean by that is we had people very resistant to teletherapy in the past, but COVID kind of forced people to have to accept some of this change. That's worked well for us. And then we had significant challenges with dental because when this first happened, we were ordered to shut down dental other than emergency procedures. And that was our highest number of patients coming in. So it really set our clinic upside down. We had to very quickly navigate through that and reestablish ourselves to basically a new normal as we go through all this. The other changes were regulatory, really looking at what is the compliance issues, because we have received a lot of federal funding grants that have major requirements for the requirements for the grant itself, but also to protect our patients and to protect our staff from the virus. And then also, if you remember, we had other things happening. We also had some issues going on of civil unrest, and we had also a lot of politics going on. Black Lives Matter, for example, protecting and standing up for the rights of people that many feel there have been many unjust things going on. First and foremost, this has required what I would say strong leadership, but strong participatory leadership. In other words, decisions had to be made, very, very critical decisions because if we did some missteps, it could be catastrophic and it could cause major challenges. For example, if we were not careful with our staff and we started experiencing COVID cases here, we could have to shut down the entire clinic because the protocol, after a certain number of employees, you'd have to shut down. So there were a lot of things that we had to really look at. For example, we only had 2 exposures here in our clinic over this entire time. And those 2 actually were fairly recent with the second wave. And so when those happened, we followed very strong protocol of alerting all of our staff. Did anyone have contact with these individuals? And basically tested people and all that, and we never had any others that came down with it. But that's an example of if we don't do things right, then there's all sorts of consequences that could happen. The other one was we were being directed by the federal agencies to furlough staff, and that furlough was a temporary laying off, if you will. But the state of California does not see it that way. The state of California has defined it that once you furlough someone, that's a termination. And based on that, that sets forward that you have to start paying everyone all their PTO and everything. And we didn't do that because we anticipated they were coming back. So there was a lot of learned lessons. And these were things that you had to be transparent and say, okay, we did not know that. We were following direction from federal agencies. Now that we know this, we're going to have to remedy these things and we're going to have to regroup. So I think there was a lot of being able to have discussions and have discussions where there might be tension and trying to help that tension be constructive rather than destructive. At times there were some tough discussions even about the political unrest and the civil unrest that was going on and some of the protests that were happening near our clinic. And it started causing emotion to come up on both sides of employees here at the clinic. And so we had to be able to have discussion and say, let's all talk about this. And let's talk about how we're feeling and let's not accuse one side or the other. Let's just talk about, gosh, what's the end game? What are we hoping that this will look like in the future? And how can we all try to move towards that and contribute to that? Trying to understand each other, even if we don't agree, and even if we believe that the other side to something is inherently evil, right? Because that's kind of what was happening, of saying, let me take a step back, and instead of looking at the situation, how did we get here? And then what can we actually do to help build some friendships and bridges here at the clinic so we can still serve our patients and their families? Our mission, our purpose, our whole being is to address the health disparities in our community, behavioral, medical, dental. And that's our mission. And we respect your mission. We respect what you're doing. We understand it. We want to make sure that we can be positioned to help everybody, but we all want to be able to learn more. So we also ask them to share information with us, share some information of what we need to be concerned about, of maybe you having mistrust coming to the doctor, for example. And I think the difficult thing is because we had COVID issues, and then we had the civil unrest issues that are civil rights kind of driven. With COVID, 33% of our patient population are Native American. So for example, we've had a challenging time even now with the vaccination because Native Americans were actually tested on back in the days. And so there's a lot of historical trauma where there's not a lot of trust. And so we had to even give pushback to some federal agencies of, hey, we're not going to pressure anybody to take vaccines or to COVID test. We're just going to tell people the truth and say, we want you to make the decision. This is one side or the other. Here's what could happen, if you take the vaccine, for example, so that they see us as a trusted partner that is not trying to force anything on anyone, that we're trying to help them understand. For example, here's your health risk. And here's why it might be a good idea to have the vaccine. But here are some side effects for the vaccine. And we're still working through this right now. We're scheduled to get batches within the next few weeks. So this is dynamic, and we're going to be living and learning as we go through this. And that's probably the number one thing is not one point have we been able to say, we got this. We don't got this. We're going to be learning the hard way and the easy way. But what we have to do is learn from the past as we move forward so we don't repeat the same mistakes. And I think we've been doing fairly well with that. our goal is that our employees would be passionate, that they would absolutely be passionate for people that are suffering from disease, from other issues like not being able to have food on the table, all of those things, that while we're here, we all have to unite for our purpose of what we have been founded for. And that is for medical care, dental care, behavioral health. And if we can be passionate for that, that's really that sweet spot. And what I mean by passion for that I don't ever want to come to a point where someone needs help and then somebody says no because I'm not aligned with your political ideology. I think that's a very dangerous path to go down. And so we've been pretty good by allowing people to share and talk, having discussions where people feel like, yeah, I can do this. I can talk about these things. It's okay to talk about them, but we don't want to get it to where I'm pushing a particular agenda that's going to push maybe other people away, because we definitely experienced people on different sides of the aisle coming here, and we were very concerned that we didn't want this to manifest where people felt their care was being reduced or trivialized based on maybe they're not being aligned with who's helping them. And that became a very important thing for me personally, just because of the years I've had in healthcare, working at Scripps, Sharp, Kaiser, Press-Amy. I know how important it is for people to trust healthcare. And so we have to never compromise that. And the same thing like with this vaccine thing. If I were to pressure people to take the vaccine and things don't go well the first few months, they're going to come back and be mad at us, and it will have eroded trust that our patients and their families have in us. So we have to be very careful of how are we doing this and thinking about it. And so some of it is visualizing. If we do this, what likely would people, maybe what would they feel? What kind of things could this cause them to feel? And some of it's been taking the different demographics within our staff and asking them, what do you think culturally? Are we going down the right path and doing it this way? Or what suggestions do you have? And listening to each other and realizing that, there's going to be error. We're not perfect. We're all navigating through all this for the first time the world's ever seen. We've never, especially in the United States, we've never seen all of these things happen at once. I think that wave two, what we're already seeing is we're getting much more positive tests than we are negative than the first run. So I think that this is, not going to get better probably anytime soon. I think this is kind of a new normal. And I think that for the most part, I'm really excited that our patients have been navigating with us and accepting of telehealth, for example, and the different things like that. So that one, we're kind of seeing that the vaccination is going to obviously be very helpful. But we're going to make sure that we're very careful how we present that when we go out, because we have mobile clinics, vans that will go out to do these things, the vaccinations, as well as testing. I just came from we did a testing in Linda Vista this morning. And so we get to talk to people while they're waiting for their results. And when we talk to them, we get to hear from them and kind of listen to them and say, what kind of things are you feeling? And what do you think? And many people today, this was an older population, very elderly, and they brought up a lot of the issues we're talking about right now. They were saying, what do you think is going to happen? Like, is our country falling apart? Things like that. So for us, we try to present optimism that we can get through this, and more start focusing on how can you take care of yourself so you can be more resilient. For example, with COVID, what vitamins you need to be taking, how you need to be eating healthy, not have stress, things that you can do to be more resilient if you should get infected. And then the other part, as far as the political unrest and things like that, just talking about what's within my control, what's within my influence, and trying to have a positive outlook and tying that to mental health. Because if we catastrophize things, it causes stress, and that stress can also impact how I carry myself or how I interact with others in the community. And so we want to try to have a calming, kind of a pause, curious learners that are like, this is interesting. How can I contribute to what's going right, to what's positive in the community, rather than fuel fighting and discontent between people and things like that, if that makes sense. Biggest thing I've learned is listening to other leaders. Honestly, all of us leaders are so overwhelmed by meetings. because on the federal, state, local, there's meetings constantly. And never in my life, I thought we've been in meetings in healthcare before. It now is tenfold. But it's been very interesting to listen to leaders go through different scenarios in their organizations, not just healthcare, law enforcement and other things, and to listen from them. What are their ahas that they're seeing? Because I may not have the vantage point in their type of an organization that I have here, and likewise. So I would say I felt a lot more collaboration with other leaders that's been really awesome to me, because I begin to realize I'm not in this alone. And I also begin to realize not only do I not have the answers, neither do they. The answers are coming from us coming together collectively so that we can try to have the greatest vantage points all come together to kind of predict what potentially could happen if we make this choice or whatever the case is. Also, the resources of the government. I've been just amazed at the resources from like Indian Health Service, from HRSA, from the county. Just amazing at how they've been able to very quickly pull things together for resources, for grant funding and things like that to help communities. And I think that's been, to me, very optimistic. It helps me have a very optimistic view of us coming together and leading by example so that communities continue to come together as well.